My name is Rodora and I'm going to be your nurse for this morning. Um, we're going to do a head-to-toe assessment, but I would like to verify first your first and last name.
First name's Austin, last name's Lindley-Shappet.
And then do you have any known allergy?
Nope.
Do you have any pain right now?
Nope.
Okay, so what we're going to do is we're going to check first the neurological of the person. Do you know where you're at?
Yep, in the clinic somewhere.
Okay, and then do you know what month it is?
August
And then do you know what year it is?
2026.
Okay, as we can see, the person is oriented to place time and also to solve a situation. Observation of the patient is wearing appropriate clothes for the weather. The skin is intact. I don't see any active bleeding or lesion. The color is appropriate for ethnicity. And I'm gonna go ahead and also check first to, let's go to with the head first. So as we can see, the head is symmetric. There's no signs of trauma, no bleeding. I don't see any signs of like infestation, like lice or anything like that. And then we're gonna go ahead and check also the facial structure of the patient. The face is symmetrical. I don't see any facial drooping. I'm gonna go ahead and ask you, can you raise your eyebrow for me? Can you smile? Okay, good. So we see that there's no facial droop and then there's an equal smile on the patient. I'm gonna go ahead and grab my pen light and we're gonna go check the vision of the patient first. So can you follow my finger? So we can see that the patient's the eyes can move side to side and able to follow the finger. I'm gonna go ahead and check your basically that. Sorry, my pen light. Okay, there you go. I'm gonna go ahead and check the outer the external of the eye first. So I'm gonna go ahead and check first the conjunctiva of the patient. It's good. It's pink and moist. It's pink and moist. I don't see any crusting or lesion on the eyes. I'm gonna go ahead and check that the pupils. Good. It's reactive. Good. It's reactive and it's pearlite. All right. And then okay, we're gonna go check your peripheral vision. Let me know when you're able to see my finger.
See it.
Okay. Good.
See it.
Perfect. All right. So the visions are intact. I'm gonna go ahead and check the ear of the patient. The external is pink, moist, dry. It's actually moist on the internal, but I don't see any lesion. It was dry on the outside. No bleeding, and then no redness as well. For this one, no redness, no swelling, no injury. I'm gonna go ahead and check also the hearing of the patient. Can you hear this? Can you hear this?
Yes.
Can you repeat what I'm gonna say? 3, 2, 1.
3, 2,
1, 2, 3.
1, 2, 3.
All right. So we can tell that the hearing is intact. We're gonna go ahead and check now the nose of the patient. All right. The septum is midline. I don't see any lesion or bleeding. It's dry on the outside, external, and then the inside is moist. Can you put one of your finger to one of your nose? Breathe. Good. The other one. All right. So we can see the airway is patent. I'm gonna go ahead and check the patient's mouth. Can you open your mouth? All right. So the gums are pink and moist. Teeth are intact. I don't see any like bleeding or thrush on the tongue. I'm gonna go ahead and check the tongue of the patient. Can you show me your tongue? Can you move it left and right, up and down? All right, so we can see that the patient's tongue is intact. And I'm gonna go ahead and check the uvula. Can you open your mouth? Okay. And then can you swallow for me? Any swallow issue?
Nope.
Nope. So no dysphagia for the patient. Now we're gonna go ahead and move to the lung sounds. So I'm gonna go ahead and check the patient's breathing. First, the patient is, we see the equal rise and fall of the chest. He's not labored breathing. let's see how much. I will check the lung sounds. Alright, so I'm gonna place this on your chest, and then when you feel it, just take a deep breath for me. Okay, take a deep breath. All lung sounds are clear. I didn't hear any crackles or wheezing. And like I said, the chest rise and fall of the patient, we can see it is symmetric. Okay? And then now we're going to go ahead and I'm going to ask the patient to lay down. I'm going to go to check the abdomen. Alright, so I'm going to go ahead and raise the shirt. Is that okay with you?
Yeah.
Alrighty. Alright, so observing the patient's abdomen, it looks like there's no distension. I didn't see any lesion or bleeding on it. I'm going to go ahead and listen to the patient's abdomen. Okay, good. So all vowel sounds are present. It's normal active. It's non-distant. I'm going to ask, when is the last time you had a bowel movement?
This morning.
This morning. How was it?
Normal.
Normal. Okay, that's good. Now I'm going to go ahead and palpate the patient's abdomen. Let me know if there's anything pain. You feel pain?
No.
Pain?
No.
Pain?
No.
Pain?
No.
Okay. So the abdomen is soft and non-distant. I'm going to go ahead and percuss. Pain?
No.
Alright, so that's good. Patient's abdomen is working as is expected. I'm going to go ahead and check the patient's back. I'm going to ask you to sit down for me. We're going to go ahead and check the spine. Alright, the skin is intact on the back, no active bleeding, no lesion. And then I can feel the bony prominence in it. Yeah, it's intact, it's aligned. I don't see anything abnormality with it. Good. Alrighty, I'm gonna ask you to lay down for me. Let's say this, I'm just gonna pretend check that the genitalia, it's pink and moist, no active bleeding, any discharge from peeing, any pain when you pee?
No.
Okay, good. Alright, so we're gonna go ahead and move to musculoskeletal. I'm gonna check first the grip, the strength, and the range of motion of the hands and the feet. I'm gonna ask you to grip both of my hands. Okay, strength is good, it's intact. I'm gonna ask you to raise both of your arms. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, thank you. Can you lower it down? Good. So we didn't see any drift. So musculoskeletal is also like appropriate. The muscles are appropriate for the person's weight and height, and also the skin are intact, no lesion, no active bleeding. I'm gonna ask you to like raise your arm, wiggle it for me. Can you move to the side? Can you move up? Can you go down? Range of motion are intact. So we're gonna move to the lower limb. Let me know if you can. I'm just gonna raise your the pants so I can see both of the legs. Alright, so I don't see any edema. They are equal. They're both in the same size to me. I don't see any redness, swelling, and then also I will feel the temperature. temperature is appropriate. It's not hot. It's not too hot, not too cold. It's just warm to touch. I'm gonna also touch this one. Temperature is also not cold, not warm. It's just appropriate for the temperature is appropriate. It's warm, but not enough to say have a fever. And to confirm that, I'm gonna go ahead and also give the patient the temperature to check also the oral temperature. I'm gonna put this underneath your tongue. Can you please let me know? Alright, temperature is 98.2, no fever, which is good. We're gonna go ahead and also check the patient's sensation. I'm gonna ask you to close your eyes and then let me raise one of your hand where you feel this swab basically, okay? Can you feel it?
Yeah.
Okay. Can you feel this?
Yes.
Okay. Can you feel this one?
Yes.
Okay. Can you feel this?
Yes.
Okay. Can you feel this one?
Feel it. Feel it.
Okay, we feel it. So sensations are intact, and like I said, the temperature is within the normal limits, 98.2, it means no fever. We already checked basically that there's no edema. Check the trigger of the skin. Okay, trigger is good, non-tenting. Skin's dry and intact. I'm gonna go ahead and check the range of motion of the lower limb. I'm gonna ask you to raise for me. Go against the gravity. Good. Can you push it? Good. Alright. So we're gonna check the circulation. Let's go with the dorsalis pedis. Alright, dorsalis pedis is good. That's 2. I'm gonna go ahead and go for the posterior tibial. Pulse is there, and it's good. I'm gonna go ahead and check cap refill for both hands and feet. Good, so that's less than 3 seconds for cap refill. Good, that's also less than 3 for cap refill. I'm gonna go ahead and check for both feet. Good, and good. So cap refill is less than 3, so circulations are good. I'm gonna go ahead and check first the cardiovascular for the patient. Can you look for the other way? Alright, no JDD, I don't see any distension. And then I'm gonna go ahead and check the lymph nodes of the patient. Alright, there's no swelling on the lymph nodes, which is good. I didn't feel anything. I'm gonna go ahead and check the S1 and S2. Okay, I'm gonna raise your shirt, okay? S1 is present, S2 is present, and I'm gonna go ahead and check the heart rate. rate of the patient is 67, and while he's laying down in there, I also check the respiration, which is 18. So that's actually really good. So we're gonna go ahead and also check the pulse oximetry or the oxygenation of the patient. Thank you. So it's reading. Alright, so the pulse ox is basically saying it's 97%, so that tells me there's a subsequent amount of oxygen exchange to the patient's lungs. Alright, what we're going to do now is we're going to go ahead and check the patient's ambulation. I'm going to ask you, sir, to stand up for me. Thank you. And then can you walk all the way here to me? Thank you. Alrighty, so the patient is ambulatory with a steady gait. And then I'm going to ask you, can you raise one of your feet? Good. The other one? Good. Alright, so the patient's balance is also intact. And that concludes my head-to-toe assessment. Thank you.